Dr. Tadych, orthopedic surgeon with Transformed Therapeutics. The purpose of this presentation is to give our patients a basic understanding about stem cells. This is an exciting new technology, and I believe it is going to revolutionize healthcare. I have personally witnessed many of my patients benefit from these treatments already, and I'm looking forward to being a part of the research to help our patients with bone and joint problems and hopefully avoid major tissue-altering surgery. So what are stem cells? These are repair cells that exist in our body tissues. We have many different cell types located in different various tissues, and the purpose is to regenerate and heal damaged tissue. They turn over tissue at different speeds. Your body is dynamic and constantly regenerating, albeit incompletely. So examples: intestinal tract, 3 days and your gut turns over. Lung, 7 days. Skin, 3 weeks. Bone, 3 years. And your heart, every 50 years. So if someone says you need a change of heart, tell them it's going to be at least 50 years. So it's easy to understand with skin. Skin stem cells live in the dermis. They replicate and they migrate from the bottom up and to the surface about every 3 weeks. And this is why when you have sunburn, it takes about 3 weeks to heal. It is also why if you permanently damage these cells through excessive UV, the cells leave you looking 12 years older than your stated age. The fountain of youth is to take care of your stem cells, and they will take care of you and do what they're designed to do. So what cells are we using? We use platelets first off, and these live in your bloodstream. These are very short-lived small cells. They are the foreman or the quarterback. There's over 1,500 different chemical messengers in each cell. This is an amazing, miraculous complexity we have only just begun to uncover. Yes, cells talk to one another through chemical messengers. The other cells are your stem cells, which are the brick and mortar. These we harvest from bone marrow or fat, adipose. Yes, you heard it, from fat. These cells live on blood vessels of the bone or fat, and it's called periocytes. They're immature cells and they have not figured out what they want to be yet. They're pluripotential. That is, they have the ability to become different tissues. The analogy is they're like military reserve men waiting to be called upon. And this fat is an amazing tissue. It's much more complex than this store of energy or cushion. It functions as a gland secreting compounds, and this adipose tissue has a large supply of stem cells, estimated 2,000 times more than your bone marrow. And they're also estimated to be stronger and better to heal musculoskeletal injuries. So the recent technology is essentially harvesting these cells from you, concentrating them, placing them in areas of damaged tissue or pathology. It's equivalent to minimally invasive surgery through a needle. Manipulation of your natural healing mechanisms and concentrating healing is the way I like to think of it. So cells control inflammation. Once they're in this area of damage, they assist the dying cells, they give them CPR, they increase the DNA production, and they produce a happy healing environment. And I'm proud to say we're principal investigators for studies on using periocytes from adipose. And anecdotally, they're doing much better than most of the other cells in my experience. So in closing, in the end, for successful surgery through a needle, you need 3 things. You need a high number of healthy cells, you need a high number of platelets, and you need a physician with a lot of experience at performing these elective surgeries through a needle. Off by an inch and it won't work. So if you seek cellular biologic treatments, always verify from the provider. Question number 1, what is your test for the number of cells and their health? Show me. 2, what proof are they stem cells? Ask them to verify these are really the real deal. And lastly, what qualifications do you have to perform these complex surgeries through a needle? Thank you.